Hello, my name is Madison Kniff. I'm in the 7th semester of Lincoln's nursing program. Today I'm going to be performing sectioning on a trach, and I'm also going to be performing trach care. Before I begin, I'm going to want to make sure that my patient is hyperoxygenated. I'm going to do an assessment. I'm going to assess the heart rhythm. I'm going to assess lung sounds. I'm going to assess any secretions around my patient's trach, respiration, and O2 status. I'm also going to make sure to talk with my patient and allow them to give me some type of form of communication if they are not tolerating the procedure well. Knock, knock, Mr. Jones. My name is Madison, and today I'm going to be your nurse. Today we are going to be performing sectioning on your trach and also sectioning trach care. Can you tell me your name and your date of birth? Perfect, thank you. So before I begin, I'm going to perform hand hygiene. There does not appear to be too much drainage around the trach, but I'm going to clean it up and suction. I'm going to make sure that I turn my suctioning on to anywhere between 80 and 120. And that has been done, and I have also already hyperoxygenated my patient. I'm going to assess to make sure, and it is working. I'm going to remove the dirty towel, and I am ready to begin. So, Mr. Jones, if you just want to raise your right hand if something were to go wrong, that would be great. Okay. And because this solution has already been used, I'm going to lip it. I'm going to open this package, being aware of my 1-inch border. Hand hygiene again. And I'm going to don my sterile gloves because this is a sterile procedure. Being mindful again of my margins. Now I am sterile, so I'm going to take my tubing out. And my right hand is going to be my dominant hand, and my left hand is going to become my dirty hand in this procedure. I'm going to hook to the suctioning. With my dirty hand, I'm going to pull down. I'm going to test my suctioning before I begin. It is working. So I'm going to go down until I either meet resistance or until the patient begins to cough. I'm not going to suction until I come out, and I'm going to do continuous suctioning. I've met resistance, so continuous suctioning and slowly pulling out. I do not want to do this for longer than 10 to 15 seconds. I'm going to give my patient a 30-second break if they can tolerate it. If they need longer, I will do longer. Go down again. I've met resistance, so I'm going to do continuous suctioning and slowly come out again, making sure to get all the secretions. At this time, I am finished doing that, so I'm going to, all the secretions are, I did not get any more out, so I'm going to remove this, and I'm going to place the oxygen back on my patient while I prepare the field to do the dressing change. So at this time, I'm going to do that. I'm going to take off my dirty gloves, wrapping everything up together. I'm going to perform hand hygiene and get rid of all my stuff here and prepare my field for the trach care. Mr. Jones, are you doing okay? You tolerated the suctioning very well. And at this time, I can also turn down the oxygen as long as everything went well during the suctioning process. I'm going to open my trach care set, and I'm going to don on sterile gloves. Once again, being mindful of the margins around my border. Again, by placing the drape. And I'm going to get all my stuff out, being mindful of my margins. And then again, by pouring solution into all 3 compartments. And then I'm going to do a 50-50 solution with the hydrogen peroxide and then normal saline. And now I am going to take the trach out, and I'm going to, this hand is going to become my dirty hand. So I'm going to pull down on this and remove the trach. At the bedside, I'm going to want to make sure to have an extra trach and obturator, just in case something were to go wrong. I'm going to let that soak for a minute. With my dominant hand, I'm going to clean it, and I'm going to pick it back up with my non-sterile hand. I'm going to clean over the trash can so I do not contaminate the field. And then I'm going to put this in normal saline solution and let that set for a second. I'm going to remove it with my dominant hand now. And I'm gonna tap inside the thing so I do not contaminate my sterile field. And I'm going to place the trach until I hear the click. Clicked. Okay, and now I'm going to clean around the trach. I'm going to dip my swab into the solution that I have not used. Just gonna clean around here. Anywhere I see any mucus, make sure to get that area all nice and clean. Now I'm going to make sure to dry the area very well so that moisture does not set up underneath there and cause infection. And now I am ready to replace the trach tie. Okay, Mr. Jones, I am going to replace your trach tie here. First, I'm gonna get it in here. I'm gonna keep the old trach tie on just to make sure to keep that in position until we are finished. Okay, I'm gonna lean your head up just a little bit here. You're doing great, Mr. Jones. And now I'm going to make sure to get this tight. I do not want to be able to put more than 2 fingers up underneath of it. I'm going to remove the old one. This one appears to be a little loose, so I'm going to make it tighter. Okay, that seems to be just about right. And at this time, I'm going to don on another pair of sterile gloves, but for video purposes, I'm going to keep these on. So I'm gonna act like I'm taking these off, putting a new pair of sterile gloves on, and now I'm going to replace the sponge. And I'm going to flatten out the V-sponge. I don't want that to be creased anywhere underneath of this area. And I'm going to put the oxygen back on the patient. At this time, I would assess the patient. I would ask him how everything went. I would make sure to assess how he tolerated it, watch his vital signs for a minute, and ask them if there is anything else that we can do. At this time, I would give him his call light back, and I would place the bed in low position.